All right, what does the approval mean for BC's rollout?
Well, the approval of the Johnson Johnson or the Janssen vaccine is obviously good news. We haven't been told when we will receive the vaccine yet, so it doesn't affect the immediate weeks in front of us, but for the second quarter, the period from April to June, we would expect to receive that, and that will allow us to continue to add priority groups to our immunizations. The more vaccine we have, clearly the sooner we can give everyone their first dose, and then subsequent to that, their second dose, so this is good news. Johnson Johnson is also a one-dose vaccine, which many people will find obviously quite convenient. Our current vaccines have been doing exceptionally well in their first dose, and that's the reason we changed our policy this weekend. But this is great news for everyone to have another vaccine, a fourth vaccine now, that will be available, and we'll be able to say more about it when we learn the amounts and when it's going to arrive.
And how significant is this single-dose vaccine?
Well, it obviously is really convenient for people. I think that they've found in other jurisdictions where they've started to use it that idea is quite popular with people. So this vaccine, like the other three vaccines, has been proven to be very effective in clinical trials. And then in the real world, Pfizer and Moderna have been extremely effective, and we expect the same from Johnson & Johnson. But just having one dose from a health system point of view is obviously convenient, and from the point of view of those receiving the dose will be convenient as well.
Could this change who is prioritized for the shots?
Well, having more vaccine is what changes things, because our approach in BC is to give priority to people by their age, first of all, because as you're older, you're more vulnerable to COVID-19, so that will continue. The main way we're doing that is through using our Pfizer vaccine and our Moderna vaccine. And it was just announced by the federal government we're getting more Pfizer today sooner than was previously expected. So it'll be by age, but the more vaccine, the fact that there's a second vaccine, will allow us to also focus on some priority groups. You're already seeing this happening. We're doing this work in our healthcare system, of course, where we've been doing essential workers for some time, and that work is continuing this week.
Anything you can tell us about the timeline? When do you expect the first doses to arrive and be administered?
Well, in terms of the Johnson & Johnson, we have not been told that by the federal government, so we have nothing to say specifically about when it will arrive, only that it's good news that it's approved and that it's coming probably in the second quarter, which means the period after the 1st of April. And so that will be good news for a lot of people then, because it's an additional source of vaccine that allows us to complete our first dose immunization even more quickly.
How does this change the rollout plans already being worked on right now?
Well, every time we get new information about vaccine, it changes things. So the information today that we're getting more Pfizer in the month of March. Across the country, it's 1.5 million. In BC, it will be between 150,000 and 200,000 doses, because we get about 13.5% of the national amount. So every time you get more vaccine, you're able to move forward your dates. And so as we get that information in, we'll update our schedule, but it's obviously good news, because it means for everybody who is waiting their first dose right now especially, it'll mean they'll get it that much more quickly.
So with that said, do you plan to give the single-dose vaccine priority over the two-dose vaccine?
Not right now. We don't have any. So right now the priority is Pfizer and Moderna. Well, we have not received any AstraZeneca yet, but we were expecting to get some of that next week. So the priorities are the ones we have. And Pfizer and Moderna have demonstrated, you see it in the evidence, their effectiveness. AstraZeneca has demonstrated its effectiveness in the real world. Johnson & Johnson is a very good vaccine as well, and that will add to it.
Lots of people are jumping to the conclusions that everything will be back to normal by July. Even Dr. Henry said yesterday she was optimistic that could happen. How do you see restrictions on the cruise ships, tourism, and travel industry? Could that be lifted sooner than planned?
I think back to normal is a relative term. I think as we are able to immunize people or get everyone access to immunization in their first dose by the middle of July, that will allow, I think, more activity, as will the fact that we are currently in respiratory illness season, and that the summer last year was a better time in terms of transmission, and we would expect that this year as well. But we will continue to obviously be living and dealing with COVID-19 for many months to come. But all of this is positive news. But what's also true right now is we're seeing a lot of transmission of COVID-19, particularly in Metro Vancouver. We've seen it in every day's case counts this week. And so right now, in addition to this good news about vaccine, we have to continue to follow public health orders. It's essential that happen right now, and that people follow the rules, especially avoid gatherings, especially avoid, of course, we're not allowed to have gatherings outside those living in our households, even in our own home. So right now, it's really important to dig in. We can see light here, and that light is in the summer, but for right now, we have to continue more than ever to follow the rules.
Just following on that thought, is that why case counts are still going up, and would there be more restrictions coming?
Well, we are seeing in the Metro Vancouver, in particular, higher levels of transmission than we saw several weeks ago, and so that's a concern. In some of the other health authorities where we saw an increase in January, such as Interior Health, it's come down. But what it tells us is that even though many people are tired of the restrictions, we need to follow them right now. We really do. This is a time when people are continuing in Metro Vancouver in particular to get sick with COVID-19. And that means we have to maintain the physical distancing, maintain the using of masks, ensure that we don't have gatherings outside our home or gatherings inside our home except with those living in our homes. That those rules have to be followed right now, and wash our hands, and all the other things that we need to do to protect ourselves from COVID-19. And right now, more than ever, we have to do those things as we go out with our immunization campaign. These vaccines work. We only have them in relatively small numbers right now compared to our population. That news is getting better, and it's more positive, and we saw that in the presentation by Dr. Ballum and the Premier this week. We've seen it in the news from Ottawa that more vaccine is coming. So all of this is good news, and we have to adapt to that, which means we have to adapt to more vaccine coming and be prepared to deliver that to people in BC, and that's the work that I'll be working on this weekend.
Will you be considering any more restrictions at all?
I think we review those all the time, and so I think what's the most important thing is that people follow the restrictions we have, because they're key. And those restrictions include restrictions on gatherings. It means we can't go out and have events. It means that we can't have people gather outside with people outside our households in our own home. That's how we limit transmission right now as we gear up immunization for a better time a few months from now.
Just going to go back to where being hopeful, things going back to normal earlier. What about events like our usual summer events that were canceled last year, like the PNE Celebration of Light or any kind of music festivals? How do you see that coming back?
I think, remember, that what we're hoping to do, and we'll probably see this in July, and hopefully now sooner than July, everyone will receive their first dose of a COVID-19 vaccine. But there will still be work to do in that time. So I think we have to be cautious. Here's what I'd say about the summer. I would say that if people have plans to travel internationally, it's not this summer still. It's not this summer. And that we'll continue to have to deal with COVID-19 into the fall. But what we can say is that there'll be more activity this summer, more ability to go around BC, more ability to come together with the ones that we love than there has been up to now. So things will be better in the summer, but for right now, we absolutely need to follow the rules for right now, and that's what we need to focus on this period ahead of us, these months immediately ahead of us, as we ramp up immunization, which is great news. We have to, all of us, follow the rules and follow the guidance of public health.
This week, Dr. Henry has said it was possible for everyone could be vaccinated by July. At one point, she said June. With today's announcement, what's the target, and when will the government update their information for ages, which still says September for 20-something?
We'll have to, when we get more information, so we got more information today about the supply of vaccine and the approval of Johnson Johnson, we adapt. So a month ago, that was bad news because we received less vaccine than we expected. Now it's good. We're getting more, and so we'll be updating that. But remember what we're talking about. First doses is what Dr. Henry said. We have to complete immunization with second doses, and that will carry on well through the summer. But we're hopeful, we were hopeful last Monday that we could get everyone who wanted their first dose by July, and it may be that time can be moved up now that we're seeing more vaccine coming to BC.
More vaccines are on the way, but daily cases, active cases, and hospitalizations are on the rise. What is the government doing outside of vaccinations, waiting for the weather to get better to reduce transmission from its current level?
We have, I think, 1,300 people doing contact tracing, working very, very hard in our healthcare system to keep people well, to support people who are diagnosed with COVID-19. Obviously, all of the steps we're taking in public health and that everyone's taking, wearing masks, avoiding gatherings, all of those things are critically important. And so in every one of our hospitals, we are preparing and dealing with COVID-19. What's improved in the last few weeks, obviously, is the situation in long-term care. We've gone from 42 outbreaks on January 15th to 6 outbreaks today, which is obviously much better. So we've seen in those settings fewer outbreaks. But we've got some work to do. There's some outbreaks currently in acute care hospitals that we need to work on. And we need to reduce community transmission right now. And that means everyone's got to, all of us have to do our part in that. And all of the enormous daily efforts of public health in helping people and supporting people with all the conditions other than COVID-19. In doing all the contact tracing and the support, all the work in workplaces to ensure that COVID-19 work plans are being followed in every workplace. All of that work by all of the public agencies and all the members of the public, it's got to continue. We've got to at this end of this marathon, which has been COVID-19, in the next few months we hope we'll be able to move on a little bit as a result of immunization. It's sometimes the hardest time right at the end of the marathon. And right now, we need everyone to follow the guidance of Dr. Henry, follow the rules of public health, and our healthcare system is, of course, working on overdrive and continuing to support people and to deal with ongoing transmission of COVID-19. So it is everything we were doing before plus immunizations is what we're doing now.
Okay, could you please, in French,
En français.
Give us your reaction of the Johnson Johnson approval, what it means for BC.
Écoutez, on est ravis de ces nouvelles de Johnson Johnson, parce que pour nous, cela va ajouter un autre vaccin à nos efforts. Ça va contribuer à nos efforts d'améliorer la situation actuelle et de protéger des gens un peu partout dans la province. Donc, un quatrième vaccin va, je pense, contribuer beaucoup à notre campagne contre le COVID-19. Et bien entendu, on ne sait pas encore quand les vaccins de Johnson Johnson vont arriver en Colombie-Britannique. On ne le sait pas, mais on pense que ça va être entre le mois d'avril et le mois de juin. Et cela va ajouter à notre campagne. Donc, on a maintenant Pfizer et plus de Pfizer annoncé aujourd'hui, Moderna, AstraZeneca qui va commencer d'arriver la semaine prochaine, et puis Johnson Johnson sans doute dans le mois d'avril. Cela ajoute beaucoup à notre campagne et je pense que cela peut donner beaucoup d'optimisme aux gens un peu partout dans nos provinces. Il faut continuer à suivre les conseils de la santé publique actuellement, surtout maintenant, mais qu'il y a de l'espoir à l'avenir parce que nous avons maintenant 4 vaccins.
Okay, and we'll go back to English. One last question on a different topic. What's your response to the ongoing staffing issues at the BC ambulance services? And what's your plan to move forward to help ensure enough paramedics are available?
Well, for 3 years we've been adding ambulance paramedics and ambulances, including last year, especially in rural and remote areas, but everywhere in BC. Over the last 3 years we reduced response times. But here's the fact of the matter, it's a very challenging time for our ambulance paramedics, and we're working with QP Local 873, the ambulance paramedics of BC, on these very questions because they are dealing not just with one public health emergency but 2. The overdose crisis has had a profound effect on the work life of first responders. There's no question about that. particularly ambulance paramedics, but also firefighters and others. And so we need to provide them with as much support as we can in these times. We've very significantly added resources to our ambulance service since I've been Minister of Health. I think 119 new full-time positions. And we have a very significant expansion of our community paramedicine campaign. In the pandemic, we increased rural and remote ambulance services significantly, but it's still a challenge because our ambulance paramedics are facing on the ground every day. Regardless of all of that investment and effort and expansion and the good relationship we have with the ambulance paramedics, all of those things are positive. But the reality of the work is very, very difficult for our ambulance paramedics when we have two public health emergencies.
Okay, that's all I have on my emails. Let's see. Are you still there?
I am. Yeah, I am.
Okay. Do you want to ask a few questions?
Who's there? Who's that?
It's Minister Dix. Thanks.
Hi. Hey, how you doing, man? I only get to talk to you on the phone.
It's sunny in Victoria. Hopefully it is in Vancouver too.
Your disembodied voice is very familiar to me.
Well, thanks again for your generosity of time.
Sure.
Yeah, I think Alan asked us all the questions. I just had two last ones I'm hoping to ask. One is, you've already addressed it, but I know, in part at least, but Dr. Henry said earlier this week, optimistically went to look at June for when everyone would have a shot in the arm who wanted one. With today's news that there's this fourth one in Canada secured the possibility of, say, 28 or more million doses of it. Is there optimism that everyone who wants a shot may be able to get one in BC by May?
Oh, I think that's optimistic, Rob. I think that what Dr. Henry said was July and maybe June. But obviously, the more that we get, the more vaccine we get, obviously, the sooner we'll be able to offer it. And so today's news that there's more in March, I think, is the best part of the news today, because it means that we can advance a number of other vulnerable groups to get the COVID-19 vaccine, amongst our seniors, right? So seniors who might previously have waited longer will be able to get it now, which is really important. And I think as well, this gives us a lot of optimism over the next few months. But there's a lot of work to be done still. And but certainly getting more vaccine, more Pfizer, which was announced today, and the prospect starting in April of getting Johnson Johnson, that obviously improves the situation. What we're going to do, because we've just received the information, we have no actual information about the timing of Johnson Johnson, Rob, so it's hard to change based on that. But we'll receive this information, we're going to adapt, and we'll be continuing to update people on progress in the coming week.
Good. The last one I had was just, I wonder if you can comment on, given the properties of the Johnson Johnson vaccine that doesn't need to be stored at as cold a temperature and can last for longer in storage, might we see that being administered by family doctors at their offices or at pharmacies?
I think we're obviously working on that. I think the AstraZeneca vaccine and the Johnson Johnson vaccines are more flexible than the other two in terms of their delivery. So we'll be able to do different things, including delivering those vaccines to workplaces potentially, right? And having many more, much more decentralized pop-up clinics as a result of having these vaccines. So they have real advantages to our delivery, both AstraZeneca and Johnson Johnson. I would say the Pfizer and Moderna vaccines, of course, we're getting in the largest quantities and have had in the largest quantities up to now, and they're the one thing I'd say about both of those vaccines is they've been extraordinarily effective. And you've seen the results in long-term care. You saw the charts on Monday. It's extraordinary. So having all of these vaccines gives us more flexibility, absolutely, in terms of how we'll deliver them. And when we get more information about when they're coming and in what quantities they're coming, we'll be able to say more about how we're going to deliver them on the ground.
Thank you very much for your time.
Hey, right on. Take care, eh?
For you too.
If you can just give me, thank you. Just quick, a minute and a half.
No worries.
I'm doing double duty.
Double duty, I got that. No, do you want mask on? Mask
Yeah,
on?
mask on. Just talk to Eric for a second. I'm just going to.
Absolutely. Of course. You see, I'm just talking to you.
He's doing two jobs.
Absolutely. The question is, yeah, no, we're going to have. It's pretty good news today, though, because anytime we've been obviously worried about supply up to now, and now we got to deliver it all, of course, which is another problem, another challenge. But we'll get that done.
What else can you tell Eric?
What else can I tell Eric? Well, I can tell him that I'll be making supper tonight, and that you know, I'm having been in Victoria all week. It's my day to make supper for my wife and I, so it'll be really nice. That's what we're planning. That's my big evening. We're going to have supper, and then we're going to watch TV.
That's good enough.
That good? Hey, right on.
Thank you.
Thank you
Thank you
very
very
much.
much.
Take care.